Welcome back. Here with us on Urban Debate on Mirror Now. In a big development, Maharashtra government has decided to remove all COVID curbs, including the mask. Yes, you heard me right. Now, mask is not going to be mandatory if you are in Maharashtra. Maharashtra is one of the states that was worst hit by COVID pandemic during the second wave, during the third wave as well. But now the state has decided to say goodbye to all COVID-related curbs. This means you don't have to wear a mask or produce the double vaccination certificate. The number of fresh daily COVID infections in the state of Maharashtra has dwindled to around 100 a day, and no new fatalities are now being reported. The decision to drop all restrictions after nearly 2 years was taken at a cabinet meeting chaired by Chief Minister and the State Health Minister Rajesh Tope. However, the government has also appealed to the people to follow COVID norms for their own safety. In the last few days, the cases in Maharashtra have come down considerably. Sample this. March 24th, the COVID count in Maharashtra was around 139. It went up slightly on 25th of March to 275. Then on March 26th, it was around 138. And then gradually it has been coming down. On March 30th, the COVID count that we saw was around 119. So this is giving confidence to the government of Maharashtra to drop this mask mandate, and it has become the first state in the country to take this kind of a decision. However, we know that some countries around the world where there has been a drop in COVID cases over the last few months have also dropped the mask mandate, but here in India, Maharashtra is the first state to do so. So let's ask the experts on the show tonight, is it the right time to drop masks? Dr. Sameer Dalwai, paediatrician, is joining us on the broadcast. Dr. Ishwar Gilada, consultant, infectious diseases and Secretary General Organized Medicine Academic Guild. Dr. Chandrakat Lahariya, physician, epidemiologist and public health specialist, joining us. Dr. Kanav Kahol, who is an health expert, also live with us on the broadcast this evening. Good evening to all of you. Thank you for joining us here on Urban Debate on Mirror Now. And before I begin the discussion, here is something that I want to say to the viewers as well. The numbers are going to be flashing at the bottom of your screens. You can also call us and share with us your views on this decision that Maharashtra government has taken. Do you think it's the right time to drop the mask? Dr. Sameer Dalwai, let me now begin the discussion with you. Is it the right time, or do you think we need to be a little more careful given the way cases are still rising in China, South Korea and some parts of Europe? Could you just unmute yourself, Dr. Dalwai?
I'm so sorry. So good evening. And I think it's more a matter of scientific decision rather than anything else. And like you quoted just now, the cases in Maharashtra have dropped to less than 100, no new fatalities. And I think for a long time, the citizens of Maharashtra, especially, I would say, I'm sure all over the country as well, have been very, very proactive in supporting the government of the day in complying with the norms. And that is the reason, like the Chief Minister said today, and the Health Minister, that is why we've been able to fight this pandemic, because of the support of people across the board. And now it's time, considering the infectivity and the fact that we have had vaccination rounds done, is a time for us to be cautious and to drop the mask in terms of not making it compulsory or mandatory as it says on your screen anymore. However, for our own personal safety, it's obviously advised that we continue wearing masks, we continue to maintain safe distance and avoid overcrowding, and at the same time, vaccination for those who may have not. So I think this is a welcome decision. It's a relief to many, many of us. And I'm sure we will still be able to face the problems ahead, if any, if the government and the people work together in following the norms.
Okay. Dr. Ishwar Gilada, where do you stand on this particular issue? Because recently in a meeting with NGOs, government shared a finding with, that the Omicron wave took a milder toll in India than elsewhere, largely due to our vaccination coverage. And now, even though center has not dropped this mask mandate, Maharashtra has become the first state to do so. Do you think it's a right decision?
I think somebody has to begin. Since beginning, we have been telling that no two waves, no two countries, no two regions are similar, and no two variants are similar. Secondly, we also have to take into account, because whenever we try to compare what has happened in the east or the west, west is going through BA.2 wave, which earlier they had BA.1 of Omicron. But in India, when Omicron was there, it was already BA.2. Secondly, in the east, they tried to have a lot of lockdowns and very strict lockdowns in the initial period of 1.5 to 2 years. So what happens with any kind of such pandemic, they would like to infect the entire population. So if you try to suppress during first wave, it will affect second wave. If you have suppressed first and second wave, it will affect in the third wave. So what has happened in India, that almost 90% of the population has antibodies, which is a natural infection. And almost 78% is vaccinated. And therefore, if you calculate that way, at least 70% population has a double immunity, which is a hybrid immunity. In that kind of situation, no fourth wave is in the light. And secondly, if at all it comes, it will be much, much lighter. Unless and until the new variant comes, which is equivalent to or more severe than Delta, we will not have any problem at all. And if we keep on getting worried about such small numbers here and there, I think we'll be killing the economy. So basically, we are already in the endemicity. We are moving towards endemicity in those places which is not there. You look at the consistent figures, the entire country has less than 2,000 cases, which we used to report from one ward in Mumbai. So if that kind of scenario is there in the entire country, and despite this, we had opening up, weddings going on, socialization going on, elections in 5 states, Holi, and you go everywhere, whether you have a mask mandate or not, people are not using masks. At least Mumbai is very well compliant. Maharashtra is better than other states. So under this situation, make it voluntary. Those who want to still use masks, nobody is going to stop them from using masks, but nobody can be penalized for not using masks. And let us wait and watch. And there are some people which are fools, and they are fooling the whole country and whole world. They are mathematicians. They don't understand medical science. And they have been saying fourth wave is coming on a particular day also, like 21st of April. And same people are saying now that June. So I think India gave them a lot of credence during the second wave when they said second wave is not going to come. And Government of India believed them because it was a government-sponsored body called National COVID Projection Council of India and Sutra model. So they are fooled. Nobody should get fooled. We don't talk about IIT. We don't talk about mathematics because we are not mathematicians. Similarly, they should not talk about medical pandemic, health epidemic, and they should not fool people just to have headlines in newspapers and coming on TV channels.
Okay, but Dr. Chandrakat Lahariya, like they say, prevention is better than cure. And as Dr. Gilada was mentioning just now, that nobody can predict the next wave. Nobody can predict the next variant that might trigger the next wave here in India. Because, you know, Omicron, it seems, is already wreaking havoc in parts of China, Hong Kong, South Korea, and some countries in Europe as well. So don't you think we also need to be a little more cautious? In any case, while the mask mandate was on, there were many, not just in Maharashtra, but across the country, who never wore masks.
What we need to remember that nobody can predict the next wave, but we definitely have a scientific and epidemiological understanding of how communicable diseases or infectious diseases unfold in a population. And what we know that in last 2 years, a majority of population had developed immunity either after natural infection or vaccination. But most importantly, what we know that same variant cannot cause a fresh wave in a shorter period. So we know that Omicron variant caused a third wave in the country in January, February, a few weeks ago. So in that context, in India, it is very unlikely that a fresh wave would emerge shortly. And that's why we are safe. Other point we need to remember, just because a number of cases are rising in a X, Y, or Z country, does not mean we should in India start wearing masks. In the pandemic, the purpose is that a local epidemiological understanding should be used for the decision making. That's part one. Second part is that in pandemic or such kind of scenario, the preventive measures are always very dynamic and agile, which essentially means what is the situation, what is scientific understanding. Accordingly, we implement preventive measures. And so we know that since the start of pandemic, all public health measures have been revised except for face mask mandate, like contact tracing, which was insisted earlier, not done in that form. Testing, which was for everyone and everyone should be suspected and contact should be tested, which that is not the scenario now. and other approaches have changed. Only face mask mandate has not changed. Now we know that when transmission is low, when people are protected from after vaccination, natural infection, there is a limited benefit of wearing mask. And when there is limited benefit, why insist on it? So I personally believe that the decision of Maharashtra government and other state governments are contemplating something similar to make mask voluntary the right decision. But I would go to one more step, that it is not enough that we say that mask wearing is voluntary. Government need to say explicitly. For example, we know in Indian states, while many things are voluntary, but the enforcement authorities go on overdrive and they find one way or other way to make it mandatory. For example, saying it's voluntary for everyone, but then there might be Directorate of Education or many schools which might insist that children should wear masks or other aspect. So we should also ensure, a government which are making such decisions should also ensure that it should not be forced upon people, even though theoretically it is voluntary, but they find a way to make it mandatory. And that is also, so government need to make an explicit decision to ensure that people, actually the decision is actually voluntary.
Okay, Dr. Kanav Kahol, then the question is, how has Maharashtra government really arrived at a scientific view in this particular case? Because the center hasn't said so. WHO is not saying that this mask mandate should be dropped. And mask became a part of life, remember, with great difficulty. It's only now that people have gotten to this habit of wearing a mask.
Yeah, I understand that all of us want this to end. But I think that the most important aspect also is to look at how many changes are happening just in the last 6 weeks. We've restarted, commercial flights that started on March 27th. People have restarted schools. And let us not forget that there's 2.84 billion people in this world who still don't have a vaccine shot, right? They happen to be in Africa, but then Africa, people travel to Dubai, and a lot of people travel from India to Dubai and from Dubai to Mumbai, for example. So I think there's just too much changes and too many changes that are happening at too fast a rate for me to be really comfortable with the fact that the mask mandate should be dropped. I think that there is definitely some prudence in us actually going ahead and continuing with the mask. As far as the scientific basis, let's also understand that a lot of things that were mentioned, things like contact tracing, none of those actually saved lives. It was the masks that saved lives. In India, we haven't been able to do social distancing, but it was the masks that have actually prevented the infection from spreading. It is true that 70% of people have double immunity. That's something that's very nice. But I think what we might see in the next 2-3 months with this increased travel, schools again reopening, a lot of things happening, is that the chances of a new variant do become quite high. So it would have been, I think it would have been prudent to stick with the mask mandate for now and wait for at least another 2-3 months and then look at it at a national level, because I think mask decisions should be taken at a national level, because what happens in one state will directly influence what happens in another state. So I don't think that there has been too much of a scientific basis. I think it's just because people talk about economic activity. What economic activity does the mask stop? I mean, we are still going to restaurants. We are still going ahead and, having everything. Mask doesn't stop any economic activity. So
actually, it will increase economic activity because mask production will go up if people will require more masks. Interesting point you've made there. I'll get my guest to respond to that as well. But before that, let's also hear from what the people have to say. Ashutosh is joining us from Jaipur this evening. Good evening, Ashutosh. Thank you for calling us here on Mirror Now. What is it that you will like to say?
Yeah, hi, lady. First of all, I'm not from Jaipur. I'm from Bhilwara. That is 250 kilometers away from Jaipur.
Okay.
Thanks for giving me a chance.
Apologies, Ashutosh. Go ahead. This is Heena from
okay.
Mirror Now.
It's okay. So I just wanted to, say that India is a kind of nation that is like always in a jiffy. When there was pandemic, when people were dying, they were like, running pillar to post for hospitals, treatments and all that. Even that time also, to all the people out there, there was a huge uproar, outcry was there. People, were like living or, getting treatments and situations was quite diabolical. And now again, when it's just a time of little respite, now people are again as if to drop the mask. So India, it's not like what I'm surmising is that the state governments are trying to imitate the Western counterparts like Italy, like England. So are we on par with Italy or England?
Got your point, Ashutosh. Appreciate you joining us here from Bhilwara in Rajasthan. Dr. Dalwai, now that's a concern too. And like I was mentioning earlier, with great difficulty, it became a habit for people. And like Dr. Kanav Kahol mentioned that, too many changes are happening too fast. How will you like to address these concerns?
With due respect to their observations, I don't think it's happening overnight. Though, of course, there are changes that have happened in the phased manner right from the last 3 or 4 months. And also, I don't think we are aping the West or anything like that. We have enough data locally. And at the same time, it's not that states next to Maharashtra like Gujarat or Goa or any other, Andhra Pradesh, has a very high incidence of COVID and we have a less incidence that we are lowering our guard. I think the time is opportune and nobody is taking away the fact that we need to continue surveillance. We need to keep watching. We need to keep monitoring. And of course, if unfortunately there is an upward climb again, we may need to reinforce certain measures. The point here is the governments are sure of all the states that people have complied to reasonably good extent. The other point also is about children in schools. They've been attending schools in this summer. Not everybody obviously goes to air-conditioned classrooms. It's only a minuscule minority that does. Most of them have to sit in the classroom wearing their mask, and many children are very uncomfortable about it. I think all these issues combined together, looking at the epidemiological data, I think right now is the time that we should go ahead. We can go ahead with this, and of course, it's mandatory. It's not mandatory to wear masks, but it's not mandatory not to wear masks either. I mean, if somebody is advised that you can wear masks for your own protection. So I think there had to be a move. We've made the move. We need to continue with the surveillance. All of us who can should continue wearing masks. But there is no reason to think that 2 months down the line, the data would have been anything significantly different not to do that right now and to do it at that time. So that's what I think.
All right. Okay, we have one more viewer joining us on the broadcast. Let's quickly hear his views as well. Suresh from Bengaluru. Good evening, Suresh. What is it that you will like to say?
Yeah, good evening, madam. I have been watching the debate. See, it is not that the pandemic has gone away from the world. China put its Shanghai and lockdown condition. When such is the case, why we should be so careless and when wear the mask? As somebody who is participating in the panel was saying, wearing mask doesn't come in the way of doing any business whatsoever. At least it will act as a deterrent to the extent possible, though it may not be the full deterrent in the pandemic situation. At least I think mask should be allowed, made compulsory at least for 1 more year.
Okay, interesting point of view there. Suresh, appreciate you joining us here on Mirror Now and sharing with us your perspective. The idea behind this debate was to understand what the doctors have to say, what the people have to say. But the bottom line is that Maharashtra government has just said that mask mandate is not mandatory. The mask mandate has been dropped. It does not mean that you can't wear a mask. It is voluntary. It's just that you won't be fined if you're not seen wearing a mask in the public place. And most people feel that mask has now proven to be a savior against pandemic. So clearly, it is something that we can continue to use as a tool and, as a mark of caution. And as I said, prevention is always better than cure. It's just a decision that the government has taken. Thank you very much, all of you gentlemen, for joining us here on Urban Debate on Mirror Now this evening.